Joyce Travelbee was born in 1926 and is known for her work as a nursing theorist. In 1956, Travelbee earned her Bachelor of Science in Nursing degree from Louisiana State University. She was given a Master of Science in Nursing degree in 1959 from Yale University. Her career dealt predominantly with psychiatric nursing and education. She worked as a psychiatric nursing instructor at DePaul Hospital Affiliate School in New Orleans, Louisiana, and worked later in the Charity Hospital School of Nursing in Louisiana State University, New York University, and the University of Mississippi. Travelbee died in 1973 at the age of 47. Travelbee developed the human-to-human relationship model of nursing. The theory was presented in her book, The Interpersonal Aspect of Nursing, which was published in 1961. The main concepts of the nursing theory are suffering, meaning, nursing, hope, communications, self-therapy, and a targeted intellectual approach. Each of these concepts is defined by Travelbee to help nurses understand the model.
Human-to-human relationship model. This model was made to assist individuals, families, communities, and groups to prevent or cope with illness or maintaining the maximal degree of health. The interpersonal process is a human-to-human relationship that was formed during illness or experienced suffering. In this diagram, we can see what is the human-to-human relationship model of Travelbee. We can see here from the bottom, we can start from the original encounter of the patient and the nurse. So they will start at being strangers, and then they will know each other's identity, and then next they will start to empathize with each other, and then they start to sympathize, and then lastly they will build a relationship, or the nurse will build a rapport with the patient, so that the patient will be comfortable to share what he is feeling to the nurse, because at first patients are really so vigilant to share anything or any information about themselves to the nurse because they are strangers. But as long as the nurse will build a rapport with the patient will be willingly to share their experiences or what they feel towards their health and their emotional being to the nurse. So that is the human-to-human relationship model.
Travelbee'S nursing meta-paradigm. The Travelbee'S meta-paradigm is consists of four phenomena, which are person, environment, health, and nursing.
Nursing as defined by Travelbee, nursing is an interpersonal process whereby the professional nurse practitioner assists an individual's family or community to prevent or cope with the experience of illness and suffering, and if necessary to find meaning in this experience. She explained that nursing is an interpersonal process because it is an experience that occurs between the nurse and individuals or group of individuals.
Person is defined as a human being. Both the nurse and the patient are human beings. Even the family and community that under the illness are human. Human beings are unique, irreplaceable individuals who in process of becoming, evolving, and changing.
Health. Travelbee stated the health is measured by subjective and objective health. A person's subjective health status is an individual defined state of well-being in accord with self-appraisal of physical, emotional, spiritual status. Objective health is an absence of the discernible disease, disability, or defect as measured by physical examination, laboratory tests, assessment by spiritual director or psychological counselor.
Environment is not clearly defined, but she defined human conditions and life experiences encountered by all men, which are suffering, hope, pain, and illness. Therefore, Travelbee refers that the nurse should be observant to the patient in the place where the patient is present. That nurse can observe and determine immediately if the patient is in need.
Human-to-human relationship, the model of nursing, has several concepts that we need to understand if it is related to the theory. Basic concept and definitions. First is suffering. Is an experience that varies in intensity, durations, and depth, a feeling of unease ranging from mild, transient mental, physical, or mental disorder to extreme pain. So as a nurse, we should know how to cope the suffering of the patient. By means of what? By means of interviewing. Interview your patients in a manner that you are both comfortable to discuss about his or her suffering. And I want to give an example. If you have a patient, a girl patient, is in a traumatic phase of her life, as she witnessed how her family wiped out by a bombing. So the initial reactions of the patient is daze. Like she cannot think properly. So she more hurt in emotional than on the physical. Sometimes observing is the first step to build human-to-human relationship. We don't need to interrupt her directly to avoid triggered and suffered. We should remember that we are the one that will aid the patient because it's easy to identify the suffering, but it is hard to justify to know what the patients really feel. Because the patients can look the nurse as a person that really cares as a human and not only a healthcare providers. Meaning, described as the reasons attributed to a person. So in this concept, as a nurse, we should be observant and a better understanding of human symptoms, burdens, and illness to identify the root of her or his suffering. Communication is a strict necessity for good nursing care. For instance, communications is the key. So as a nurse, we should have a good communication to help human-to-human relationship. So we should use the two purpose to obtain information and to influence others for having an effective communications towards your patients.
Using himself therapeutic. One is able to use itself therapeutic. Self-awareness and self-understanding. Understanding of human behavior. The ability to predict one's and others' behavior are important in this process. Targeted intellectual approach. Nurse must have a systematic intellectual approach to the patient's situation.
Hope. It is a mental state characterized by the desire to gain an act or accomplish a goal combined with some degree of expectation that what is desired or sought is attainable. 6 important characteristics of hope are dependence on other people, future orientation, escape routes, the desire to complete a task or have an experience, confidence that others will be there when needed, the acknowledgement of fears and moving forward its goal. Without hope, there is no direction for lessening suffering, and as a nurse, you can help the client to have hope but do not give false hope.
Acceptance by the nursing community. In practice, the hospice nurse attempts to build rapport with the patient as well as with his significant others. Understanding illness and suffering enables the patient not only to accept the sickness but also to use it as self-actualizing life experience. In education, the concept of Travelbee serves as a better assistance for nurses who help individuals understand the meaning of illness and suffering. And lastly, for the research, the researchers acknowledges nursing interventions that would support this process. Mr. Mumar Rodriguez, 50-year-old male, a patient admitted to the neurological unit. He was diagnosed with a spinal tumor 5 months ago and metastasized to the other parts of the body. He appears pale, weak, and thin. He complains of difficulty in walking that leads him to a fall, incontinence, loss of sensation, muscle weakness, and severe back pain radiating towards legs and arms. Mr. Rodriguez was experiencing back pain over past few months that he could hardly perform his activities. He was a busy and active man. He got divorced 6 years ago with a daughter. His daughter is already married and lives in Texas, USA. He is living alone with no one to take care of him. He has been admitted to the hospital for 1 month now and seems very depressed, weak, and fragile. He is in a lot of pain and not sleeping well. He has lost weight and his disease has progressed rapidly.
Sir, may buntag.
May
Kamusta?
Okay lang man.
Ako ay mong nurse karong buntag, sir, for 8 hours. Mag-check sa tayo mong ano, sir, vital sign. Kamusta man, sir?
Okay.
Okay lang ka?
Sakit lang akong likod.
Nagkaon na ka, sir?
Ay, wala ko tarong nakaon kay lain akong paminaw karon tungod guro ni sa akong kwan o pair.
Nakainom na kagtambal, sir? Wala pa?
Wala pa.
Kamusta man gabi, sir? Okay,
Okay
na
lang.
kayo mga attending nurse?
Oo.
Wala may problema? Okay. Okay man imong vital signs, sir. Nya, dili man lisod sa imong ano, sir, magigda ka, okay ra ka?
Okay lang.
Gusto nimo taasan na imong ano, maglahay bakresta?
Dili okay lang.
Okay lang pud ka? Okay lang sa imong mag-side view ka, sir. Wala may problema, sir. Tabangan ka na mo.
Okay lang ni kay mas komportable ko kung ing ani.
Okay. So naa pa kay iba ginaano, sir? Ginabatyag? Naa kay problema, nalain?
Kwan lang, ginamingaw lang ko kay wala akong kauban diri.
Asa di imong mature, sir? Wala imong igsuon dire, wala imong mga anak, asa imong asawa, sir?
Wala. Kay nagbulag naman gud niya sa akong asawa, nag-divorce ni tapos ang akong anak ko nanay lain na pamilya.
So kisa imong kauban dire, sir? Imong igsuon wala po, do ay nagbisita dire nimo?
Wala, ako lang.
Okay, sir. Nga, tawagan na nato imong ano, sir, imong anak, sir, para may istorya nimo, sir.
Ayun na kay daghan po siya trabaho tapos na po siya yung anak.
Ang ginasikaso.
Mm-mm.
Nya paunsa na lang na, sir, kay murag dili kayo ka okay ba? Kag ang imong vital sign okay lang po, ang resulta sa imong mga medical okay lang po, pero makita na ko sa imong, sir, murag dili jud ka okay, sir ba? Tara kay ginabatyag, sir.
Depressed lang po, nurse.
So, ano na lang, sir, ibuhato na lang nato, sir. Kung okay lang sa imo, ha, tawagan yung personal imong pamilya, imong anak, para makaistorya good nimo, sir, nya. Para dili ka kayo depressed, feeling mo good na ako, sir. Ingana imong reaction karon, sir, kay imong physical reaction, sir, kay mag-depress kaayo ka kay wala kay communication sa imong pamilya. Nya wala pud may naga-cheer up sa imo diri, kay wala kay watcher nga nagaadto. Nya di pud ka kakaon mayad kay daghan ka ginaisip. Nya ana na lang, sir, tawagan natin imong anak, sir. Pero kung dili jud ka, sir, pwede man ka magbasa, sir, kung ay kay cellphone, pamati ka sa mga ano good, mga spiritual songs. Pero kung para sa ako, sir, ha, mag-open jud ka sa imong anak, sir, sa imong ano, para mahagan yung imong ano, sir, naisip niya ma-okay ka.
Siguro nabaguhan lang ko kay workaholic kayo ko. Tapos karon din na ako ka-gym. Tapos wala na ko ikwan, exercise ko. Tapos ang akong ginaisip ko na ako akong trabaho. Tapos bago pa may fresh pa kayo ang pagbulag na ako sa akong asawa. Tapos kwan, wala man po sila katawag sa ako. Murag, di man po sila kabalo na hindi akong mahitabo sa ako.
Sige, sir, nga. Ang buhat ko na lang namo, sir. Try na ako i-kontakon ang imong watcher o kinsa may imong immediate family dire, sir. Kaya naaman na dito sa files nimo, na dito sa chart. Try na mong istoryahon kung pwede sila makatawag sa imo, ha, or pwede sila mag-adto diri para ka-istoryahon ka. Sir, kaning dapat imong buhaton, sir. Paggawas nimo dito sa ospital, hopefully ma-discharge na ka, sir. Adto kang simbahan, or adto ka kung sa mga places na malingaw-lingaw gud ka sir, makakuha kag positivity kay murag ana gyud ang kailangan nimo sir ba. Nya pag abot sa trabaho sir, di man ka makabalik sa trabaho pag dili ka okay. Mong isipon lang jud mo sir nga maayo na ka, makagawas na kadayon para yung murag mabalik gud sa normal na imong kabuhi. Nya dili man jud mabalik sa tong dati nimo nga ginaobra, at least man gud nang dahan-dahan lang ba. Dili man ka makatrabaho na, dili man ka atong gym, dili ka maka unsa pa imong daily nga ginabuhat sir, pero at least ay pinaka-importante kung naakay connection sa imong family ulit na may communication, murag dila magud ka maayo sir, feeling lang jud na ako. Okay sir ha, magbalik lang ko niya pag time na sa imong tambal, ayo-ayo sa ka sir, kag pwede na ka matulog-tulog sa.
Physical assessment. There is comprehensive initial physical assessment focusing on systems, symptoms, height, weight, and vital signs. Regular assessment and monitoring for any changes to the client's response to illness. In-depth assessment for any presence of cancer-related pain. Assessment of mental health status and how he is coping with his disease. Psychological, spiritual, and cultural assessment. When assessing Mr. Rodriguez, we need to take in consideration the impact and meaning of illness on him and his family. Also the circumstances and their view of life. We need to assess his response to the cancer, concerns, feelings, fears, understanding of the disease, prognosis, and his goals. Mike's support and his preferred role in decision making. What are his influences as it relates to the illness or experience, treatment, family coping mechanism, and communication.
Goals. The following are some of the client's goals. First, the client will get better after 2 to 3 weeks. Second, the client's pain level will decrease and his sleep will get better, which will help with his mood and depression as well. Third, the client's stress will reduce and he will cope better with his disease. Fourth, the client will get his appetite back, eat better, and gain weight.
Nursing interventions and rationale using Joyce's Travelbee'S theory. Based on human-to-human relationship model and nursing process by Joyce Travelbee, the interpersonal relationship is shown to be important for clinical care. The stages of relationship by Travelbee are defined as first, encounter, identify the emergence, sympathy, empathy, and harmony. In this case, the nursing process is established by using those following steps. Establishing nurse-client relationship. The therapeutic relationship is established and maintained by using nursing knowledge, skills, and caring attitude. Behavior by gaining trust, showing respect, empathy, power, and professional intimacy. The nurse involves the patient to take decisions regarding care and treatment. Pain control. To relieve his pain, he will give a comfortable position, start relaxation therapy, and provide comfort measures and administer the prescribed prescription. Improve the low esteem and nutritional status. Using the second stage, where the nurse and the patient express their identities, values, and meanings. The patient feels comfortable to express how the disease affects his physical, physique, and social spheres. Listening to his concern, the nurse provides emotional and spiritual support. Improve the physical disability. Using the empathy, the nurse tries to understand the mutual and process. The nurse assesses the physical capabilities, what the patient can do or to assist him with his daily activities. Provide spiritual and emotional need. As in the fourth moment, there is the sympathy phase, where the nurse stands and supports to help the patient to face the problem, the illness, and the treatment. The patient expresses his fears and anxieties, stating that he can live more sad moments. In order to achieve the expected result, the nurse arranges counseling, emotional and spiritual, and active listening activities that are fundamental to improving the needs of the patient. Provide emergency services to call. As per the bond, a committed relationship between the nurse and the patient. The nurse provides discharge teaching including the next chemotherapy session, how and when to take the medication. Emergency phone number to call in hospital, financial support, services, and volunteer support if needed.